Jummy Opedare, a devout woman of God, wife, mother, and entrepreneur. A God-fearing woman who has devoted her time to ensuring that God's message is used to empower everyone, but most especially women. With a strong belief in the importance of women empowering women and educating each other through our life experiences, she is the founder of Women's Forum, Let's Be Real, a forum for women to work through issues and set and accomplish goals together. Held every second Friday of every month at 6 Elton Road, Lee Green, London. Keep up with Let's Be Real here on PRZ FM. Every Tuesday, 8 p.m. to 9 p.m.
Hello everyone and welcome to another episode of Let's Be Real on PRZ Radio 109.2 FM. My name is Jummy Opedare. I'm so delighted to be here again to bring this program to you wherever you are. Thank you for tuning in every Tuesday. I believe that you have been gaining one thing or the other. God bless you, really good. I'm so delighted to have in the studio with me my very own Dr. Akinkinte Oyekan. God bless you for coming in.
Thank you very much.
Okay, on Let's Be Real, we talk about real life issues, things that affect our lives. And I believe that you, our listeners, have been benefiting from this particular program. We want to hear from you, whatever you have gained. If you have any suggestion of the topic that you want us to bring on here, please, you can email it to us on letsbereal@przfm.com. letsbereal@przfm.com. And if you have any question, if you have any comment, please email it to us and we'll respond to you as soon as possible. Thank you so much. Tonight we are talking about our Earth Hour again. Earth Hour, because we know health is wealth. It's very important for us to look after our health, to be aware of things that are happening in our community, in our environment, in our bodies. So we have got in the studio with me my very own doctor that is going to break down this particular topic for us today. And the topic I'm talking about is stroke. I know if you look around you, you would have seen many people or some people or one or two that have suffered from stroke before. And many people are really, this is happening a lot these days. And I thought we need to be aware of why, how, what can be done, what should be done, what should we know about it, so that we can prevent this nasty occurrence happening in our environment. I know that it might not be relevant to you, but it might be relevant to someone that you are going to save their lives. So I want you to listen attentively. And if you happen to miss any of this show, you can go back on SoundCloud and download all the previous episode of Let's Be Real by typing in Jummy Opedare, and everything will come up. You will pick the particular topic that you want to listen to over and over again. And if you have any question, please send it to us and we'll be able to answer them. Dr. Kenny, thank you so much for coming in. We want to talk about stroke. And I know that I've heard so many stories about this, and I want our people to benefit from having awareness of what this particular issue is. So please, can you tell our people what stroke is?
Yeah, thank you very much for this opportunity to encourage people and to raise awareness on a potential medical emergency. The topic we're discussing today, stroke. Some people might have heard this being called CVA, which means cerebrovascular accident. Is one that goes in line with our general theme recently of cardiovascular disease. So we've talked about high blood pressure. Last time I was here, we talked about heart attack. And I think it's appropriate that we continue the theme and we discuss stroke. So stroke being the colloquial or the everyday layman term, what is a stroke? A stroke is a medical emergency, and it's a medical emergency in which there is a sudden lack or reduction in the blood supply to an area of the brain. and that's essentially what is happening. Like in a heart attack, where you have a narrowing or a blockage in the blood vessels in the heart that supply the heart with blood, which carries oxygen and the various nutrients that the heart cells need to work. In a stroke, you have a problem with the blood vessels that supply the brain. And if anyone is not clear on what the brain is the large organ that your skull protects, which is in your head. And the brain is extremely important in everything that we do. It's important in allowing us to obviously think and make decisions, and allowing us to see, allowing us to smell, hear. It allows us to walk, allows us to swallow. So there's so many important things that the brain itself does. And so if you have a sudden problem where the blood supply to the brain is damaged, then you can have potential problems with any of these functions of the brain. So that's what a stroke is. It's a medical emergency in which you've got a reduction in the blood supply to the brain. And that reduction in blood supply can be either due to a blood clot, something blocking the pipe, the blood vessels that supply the brain, or it could be due to a sudden bleeding that happens in the brain. So if the pipe is burst and you've got blood leaking out of it, then it's not able to get to the area it's supposed to get to. So in the same way, you've got a reduction in blood supply. So that's essentially what a stroke is.
Wow. Thank you so much, Dr. Kenny, for explaining this to us. That stroke is called a medical emergency, and is when there's a shortage of blood supply to the brain,
Yes.
or there is a pipe burst and there's bleeding in the brain. So this is very crucial, because they are not things that we can see. And why is it an emergency?
So the sudden blockages in the pipes are called ischemic stroke, and if it's to do with bleeding, it's called a hemorrhagic stroke. So these are things that you might have heard, or you might hear doctors talking about, they had a ischemic stroke or they had a hemorrhagic stroke. Why is it important? Why is it a medical emergency? It's a medical emergency for two things. One is that every medical emergency usually means that there's a potential to lose life. So strokes kill people. But also medical emergencies tend to be things that can cause significant future damage to a person. So strokes cause significant morbidity, which I'll explain shortly. Medical emergencies also are potentially things that happen suddenly and which we can treat and cause a great effect in terms of resolving symptoms. So again, if we act quickly with stroke, then potentially one might end up being cured completely from it, or at least the disability can be significantly reduced if we act quickly and identify it. So why is it important to act quickly to treat it as a medical emergency? Is because some people after a stroke have problems with paralysis, so that they have significant weakness in their arms, legs, or in parts of their face. Some people after a stroke can have problems with swallowing. So can you imagine a situation where you're struggling to swallow food? And this is a significant issue, because if you don't have the ability to swallow properly, then there's a risk that the food you eat, the drinks you drink, either they come back out or they go down the wrong pipe.
Wow.
And so instead of going down into your stomach, they go into your lungs. And if food or drinks go into your lung, it can cause a significant infection. You can you can actually drown, yes, potentially. But more worryingly as well is that you can get severe infection that can be difficult to treat. So that's a potential significant symptom or effect of a stroke. People who've had a stroke can end up having problems with their vision, so that they end up being blind in parts of, and they can't see certain areas of the vision. So they can lose the ability to see properly, and they can have problems talking. And some people with a stroke can either have problems voicing what they want to say, even though they know what they want to say. So it can be extremely frustrating that in your head you're saying what you know what you want to say, but you physically can't talk or talk in a coherent way. So that's something that is potentially significant. Also, stroke is associated with problems with your memory, so that you all of a sudden can develop a type of dementia called vascular dementia. So you end up having problems with your memory. You can't remember your loved ones, or you can't remember where you left your keys, or you can't remember if you've left the stove on or the gas cooker on, and this potentially could end up being dangerous. But this is something that's quite significant. And some people who've had a stroke, they can have problems eventually with their behavior, so that they become slightly different. So these are just a few of the things that can be potentially long lasting that one has to be aware of. But importantly, again, just like with heart attack, strokes can kill. So it's so important that we understand that this is why it is an emergency. This is why we need to be talking about this today.
I really appreciate the fact that you have explained this. I now know that stroke is an emergency. It's an emergency. With all this, nobody wants to die suddenly. Nobody wants to be have a significant damage to their body, that they can't move the right way, they can't eat, they can't swallow. It's an emergency. Nobody wants to have infection that can lead to many other things, and nobody wants damage in their behavior that people don't understand them. Even they have been on, people understand the way they behave before, and suddenly there is a change. All these situations that you have explained, I could identify with them that they are really, really emergency situation.
Yeah, and I can give you some statistics as well. I mean, it's not always nice to bore people with statistics, but I think some of them are quite important. I've got a few here. 100,000 strokes in the UK each year. That equates to 1 every 5 minutes. Stroke is the 4th largest cause of death in the UK. Wow. Okay. And men are more likely to get stroke than women, but women are more likely to die from strokes. Wow. So these are things that, and for a lot of our audience, which might be from the African or ethnic minorities, black people are almost twice as likely to have a stroke than white people. Okay, and studies suggest that black and South Asian people tend to have strokes 10 years earlier than white people. Wow. And I think this is one of the most starkly one of the most important ones that I found, is that in the last 20 years, stroke incidence in London has decreased by 40% for the white people, but has not decreased for black people.
Wow, why is that?
So these are things that we have to be aware of, and it's to do with the risk factors. It's to do with understanding of the symptoms. It's to do with education. It's to do with how we take care of ourselves.
And that is why it is important. We are on Let's Build It now, PLZ Radio 109.2 FM. We want to talk about the things that are real. Why should it be that in ethnic minorities that these things, the figures are not going down, things are not getting done? Maybe we are not doing the right things, maybe we are not obeying the right rules, maybe we are just being ignorant, maybe we are just not aware. There are so many things that could contribute to this fact that among the black ethnic minority, things are going, bad thing is going up, and other people that have the knowledge or awareness is going down. I just want to believe that we need to be paying more attention to these things and do the right thing. And that is why we take it seriously in Let's Build It to talk about Earth Hour. We have dedicated Earth Hour so that we can make ourselves aware of things that we need to be aware of. We should not be part of statistics. Why should it be us? We should not be. I will not be a part of statistics in Jesus' name, and I believe that all our listeners will not be, because we just have to do the right thing. So we are talking about the why is it an emergency? I believe at this point in time, it should be every one of us should take it as an emergency situation to pay full attention to all these health issues that we are discussing. So please, Dr. Kenny, what are the symptoms of having a stroke? Because some people, we just discover that, somebody is has suffered a stroke, but we don't know. Maybe the person have been seeing one sign or the other, and they have been ignoring it. So there's no sign, there's no warning sign. Stroke just happened.
Okay, so I'll tell you the symptoms of a stroke. There's a common acronym that has been developed to make things easier that describes a few of the symptoms that are easy to recognize and are usually reproducible. So the acronym is FAST, F-A-S-T for FAST. And each letter has something that we have to look out for. So F in the FAST stands for face drooping, and that means that usually on one side of the face there is a difference to the other, so that it looks like the eyes are sagging down or the lips are sagging down or the skin is just wrinkly on one side of the face, and there's what we call a facial asymmetry. It's not looking the same. So that's the F in FAST.
Okay.
So that's one thing. If you're looking at a loved one and all of a sudden their face looks different, you have to have the alarm bells going on that something significant might be going on, especially if it happens suddenly. A is for arm weakness. So if someone all of a sudden has difficulty with weakness in their arms, and the way you test that is to ask them to lift both of their arms up and ask them to keep it there. And people who are having a stroke acutely will struggle with keeping their both arms there. They usually might it might be okay with one of the arms to keep it up there. The other one will start to come down because it's weak. So that's one thing you ask them to do, to straighten their arms and try to keep it up in the air and see what happens. And the other thing is that they'll have problems talking as well. Their speech will become slurred and it will be less coherent, or they might not be able to talk at all. So if you start to have this combination of facial asymmetry, the arm weakness, problems with speech, then the T is for time. And T for time means that you need to, it's an emergency, you need to get emergency services. In the UK, we dial 999. Each country will have their emergency number and emergency protocol. But essentially what it means is that you need to seek urgent medical attention. Urgent means immediate, as soon as possible.
Wow, thank you so much. So we need to look out for face dropping, and individual that is going through this will be able to know that there's something wrong with their face as well, isn't it? Yes. Okay.
Well, they may or may not know that their face is drooping on one side. So that's why it's important that people are looking at people are looking at. But if you look at the mirror, then you might notice that something is going on. But,
will it come with any type of pain?
Well, they might not have pain.
They might not have pain. It's just the look.
They might not have pain, but they might realize that their face feels a bit odd because they often might have problems with numbness in their face as well. Okay. But this is where this stroke symptoms is important for people to recognize loved ones or people around you who might be having a stroke.
Wow. And arm as well. You don't need someone to tell you that your other hand is coming down before you've...
So if you're suggesting how can I check if I myself am having a stroke, so you might notice that if you look in the mirror, your face might not look the same. You might notice that your arm feels numb. It doesn't feel right. It feels a bit like you maybe have pins and needles, or it might just feel like when you touch your arm, it doesn't feel the same on both sides. And if you try, and you might notice that your arm all of a sudden feels like it's heavier, and it's much more difficult to keep it up. So, and then when you're talking, it doesn't. Either you can't talk or you're struggling to talk.
Wow. Okay. So speech problem and time. As soon as you notice any of these three, before you finish, it's better call 999 or someone around. Call 999 because I believe that Dr. Kenny will tell us why time is so crucial when we are talking about when we progress in this particular program. So we have learned that FAST is the acronym for symptoms of stroke. So when we see the face dropping, we see the arm weakness, we see the speech not like normal, and then we need to be time conscious that we can't delay anymore. Call 999. I think in America is 911. In Nigeria, I don't know what we call. In Canada, wherever you are listening to us, there must be an emergency. If there is no emergency system that you call, make sure you get that person to the nearest hospital as soon as possible, so that you won't waste time. Don't wait for another symptoms. As soon as you have noticed this 3 before T, start to take action. And we will not be a victim of stroke in Jesus' name. Okay, what are the risk factors?
Okay, so the risk factors for stroke, if you've been listening to some of our other discussions, you'll realize that it seems almost like we're always talking about the same thing when we're talking about risk factors. And for anyone who's not quite clear, when we're talking about risk factors, we're talking about certain criteria, certain predisposing issues or factors, certain things, qualities about a person that might mean that they're more likely to develop a disease or condition. And so the risk factors for stroke are very similar to the risk factors for getting a heart attack. So you'll be encouraged that if you can sort out or try and manage some of these risk factors, you're not only reducing your risk of getting heart attack, you're reducing your risk of getting stroke, reducing your risk of getting problems with like diabetes, but also reducing your risk of getting problems like kidney disease or cancer as well. So essentially it's all about trying to do certain things to give you a better health. Okay, so the risk factors for stroke, similar to a heart attack, include high blood pressure. And we've talked about high blood pressure in the past and being like a silent killer. And this is why it is like a silent killer. It's associated with increased risk of stroke, increased risk of heart attack, which can both cause sudden death. But it's also associated with kidney disease as well. So if you are someone who is certainly above the age of 40, 50, and you've never had your blood pressure checked, it's something that's quite important. You need to know if your blood pressure is high, because you might not be getting symptoms of it. So the symptoms of high blood pressure you wouldn't notice until it's very, very, very high, and that is at a point that is life-threatening, and most people are not at that stage straight away. So that's why it's important that one has a check to see what their blood pressure is, and their GP might, or their family doctor might, prescribe medication. It's important to take the medication. There's no point knowing you've got high blood pressure and you're not taking the medication. There's no point taking the medication if you don't know what the medication is working. So you need to have further checks to make sure that the medication is working. Some people are on one tablet to start off with. They end up needing to have another tablet, or sometimes 2-3 tablets to control the blood pressure. So it's very important that one looks at that. Smoking is also, we've talked about smoking in the past. Smoking is associated with lots of medical problems, including types of cancers, chronic lung disease, problems with breathing, but also is associated with cardiovascular disease. That means disease of the heart and blood vessels. And remember that we're talking about potential narrowing in the blood vessels supplying the brain, potential blockages in these blood vessels, and smoking contributes to making your arteries narrow and increase your risk of getting blood clots. So that's something that one has to be aware of. And if you are someone who smokes, it's something that you really need to think about stopping. There won't be any doctor that will tell someone not to stop smoking, short of if you're 99 or 100 and that's what you've done your whole life, then there might not be any point. But there's always a good benefit to stop smoking. Initially it might feel very uncomfortable, but long term you'll be reducing your risk of long-term disease. Diabetes as well. So one of the things that one has to check as they get older is to keep an eye on what their blood sugar level is, because some people get diabetes when they're young and they very quickly know about it because they get very sick. And some people, they don't know they're diabetic until much later on in life, because diabetes can sometimes come in adulthood, or most times it comes in adulthood anyway. And so it's something that one has to check, because they're good medication to try and control your blood sugar level. And diabetes is a condition maybe we'll talk about at some point, but it's not only associated it's not only associated with heart disease, not only associated with stroke, I think we have, but also associated with problems with your vision, problems with your kidneys, problems with
Limbs.
with your limbs as well, so that one of the strongest reasons why people have amputation, which means you cut off a part of the body, is because of diabetes, because people lose the feeling in certain parts of their body, and so they end up having problems like ulcers, or they get wounds that they don't notice until it gets infected, and eventually the bone starts to get infected, and it becomes very difficult to treat. So it's something that is very important. I've seen lots of patients with badly controlled diabetes ending up needing amputation of part of the body, and it might end up being a toe, 2 toes, 3 toes, part of your foot, your leg after your knee or before your knee, and it could be arms as well. So it's very important that diabetes is well controlled. And if you're someone who's young, who is unfortunate to be diagnosed with diabetes, young patients with diabetes as well can be very difficult to treat, because they go through a very hard time. They're in hospital a lot initially whilst everything is getting under control, and sometimes they want to rebel because their life is not like every other teenager's life. So if you're a parent with a child with diabetes, it's very important you encourage them and not always tell them off, but try to understand where they're coming from, because from a young age, having to inject themselves with insulin, it can be something that is difficult to deal with. So, but then again, if you allow yourself to let go and not care about it, there are consequences. One of which is stroke. We've talked about diet, the importance of a good diet, one that doesn't have too much fats in it, one that's balanced, one that doesn't have too much sugar in it, because that increases your risk of diabetes, one that's not got too much carb, everything in moderation, because you want to have a healthy weight life. So a poor diet is associated with the cardiovascular disease, again, diseases of the blood vessels, where there is narrowing. So we talked about this with heart attack, and so I encourage people to listen to our discussion on heart attack, because a lot of these are related, and I might have talked about in more depth in previous talks. Obesity, all of these are interlinked. So people with diabetes, who smoke, who have high blood pressure, who have poor diet, and a lot of them have problems with weight as well. So if you're overweight or obese, then it's something that one has to think about, because reducing your weight helps you with all of these risk factors, but also reduces your risk of stroke as well. And there's something called sedentary lifestyle, which I've talked about before, and it's that lack of physical activity. So that is the people that don't exercise at all, who are just, some people say couch potatoes, but who are just who don't have any sort of physical activity in their life, apart from going to work, maybe getting back home and watching TV. So people like this are increased risk
and
of
stroke sitting down by the computer all day.
Yes, exactly. So exercise is very important. It's really important. Some people are unlucky, and not unlucky. Some people have developed an irregular heart rhythm, so that the heart is not beating in the normal way, and these people might be at risk of having problems like fast heartbeat or slow heartbeat. But the fact that the heart is not beating regularly in a controlled fashion increases your risk of forming blood clots. And so if you can form the blood clots around the heart, and these then travel through the bloodstream, and they can either go to your lungs, your legs, they can go to your brain, to the blood vessels in your brain, and they can cause a stroke. One of the common irregular heartbeats is called atrial fibrillation, and that is usually shortened to AF. So you might know someone who has been told you've got AF, or you might know yourself that you've got AF. So people that have got this irregular heart rhythm, we often prescribe medication to thin the blood. In the past, the common medication was called warfarin, which a lot of people were scared of because it was the medication that they used to give to rats. It was rat poison, so a lot of people didn't like it. But it's still used today. It's a very good drug. We know how it works. We've got an antidote for it. The only problem with this drug is that we have to check that we're giving the right dose frequently. So you might need regular blood tests. there are newer drugs that mean you don't need to have these regular blood tests.
Okay.
So if you've got this irregular heart rhythm, and it's part of a general checkup, so when you get to a certain age, above 40 or so, you need to see your family doctor. You need to see that your blood pressure is okay, your blood sugar level is okay, your blood cholesterol is okay, your heart rhythm is okay. These are the things that the doctor does to try and reduce your risk of getting sick later on. So it's a good thing to see your family doctor and to keep appointments as necessary. Now, one of the illnesses that is, something that's potentially common in Africa, in certain parts of Africa, the Mediterranean, in African Americans, is sickle cell disease. Now, people who have, a lot of Africans will know someone who's got sickle cell disease, and how it affects them. So this is a condition that is inherited, that means that you have blood, you have problems with your blood hemoglobin. That means that you are at increased risk of getting these blood clots and to get an irregular shaped red blood cell that can sometimes block blood vessels and cause severe pain. But in the same way that it can block blood vessels, can cause severe pain, apart from so many things that sickle cell can cause, one of the things it's associated with is stroke, and often stroke even in young patients.
Wow.
So stroke is not a condition only of elderly people. So there are some unlucky young people that get stroke, and usually it's because of a problem from birth, like you have a problem that means that you're forming blood clots more than normal, or you have a problem with the development of the blood vessel that means that they're more friable, so that they're more likely to suddenly burst and bleed and causing a stroke. Apart from that, running through these very quickly, the older you get, you're more at risk. We talked about gender,
age,
as well. And again, one of the risks for stroke is that you've had a stroke in the past, or the concept of mini stroke. And this is something that's important to talk about as well, because a mini stroke, sometimes called a TIA, which stands for transient ischemic attack, is essentially a condition where someone gets the symptoms of stroke, happen suddenly, but they resolve, and the timeline is less than 24 hours, but often it's within a few minutes, 30 minutes. All of a sudden you have significant weakness in your arms. All of a sudden you have significant problem with your memory that gets better. All of a sudden you have problems with your speech that resolves. This is important. Even though it's resolved, don't just say, oh, it's the devil, or it's just something that needs to be ignored, because it could mean that you've got this mini stroke. And the importance of identifying mini strokes is that it means you're at risk of getting a full-blown stroke. So that you need to seek urgent medical attention, because there's certain things that the doctors have to do to try and check if A, it was a mini stroke, but B, if you've got risk factors for stroke. Because it could mean that you've got an irregular heart rhythm and you need to be on blood thinning medication, high blood pressure that needs to be controlled, diabetes that needs to be controlled. It could mean that you've got problems with the blood vessels in your neck that some people need surgery for this to try and reduce their risk of stroke as well. So it's very important, if you have symptoms of a stroke that suddenly resolve, it's not just, oh, this was a miracle. Yes, we thank God, but it could mean that this is a mini stroke, and it's a warning sign that you might be at risk of getting a stroke as well. So these are, there are other ones to talk about, but I think we've talked about some of the main ones at the moment.
Thank you so much, Dr. Kenny. There are so many risk factors that you have just mentioned now. There are some that we can do something about. There are some that we don't have control over, something like our gender and age. But I just want our listeners to understand that this risk factor does not mean that definitely you will have a stroke, but it will reduce your probability of having a stroke if you do something about the ones that you can do something about, like the high blood pressure. Many people in my community does not know the level of their blood pressure, maybe is high or not. And I've always, many a times I've heard people that they are on their sick bed, maybe on life support machine, on a critical illness before they discover that they have high blood pressure, or before they discover that they are diabetic. So I think it doesn't have to get to that stage. That's what we are saying, that high blood pressure, check it, go to your doctor, check it, buy the machine and check it. Smoking, you can do something about that. Reduce it, cut it off completely. Diabetes, reduce what you eat that causes too much blood in the system, and poor diet as well. We can do something about that. Obesity, we can do something about that. If you watch some programs, you will see people that have lost so much weight and they are living healthier life. So it's in our willpower. We can do something about that as well. Lack of physical activities. I think we've been saying this almost every month. Every month we say this. 30 minutes brisk walking. You don't have to register in the gym before you stay healthy. Eat right. Do some walking, get off the bus and do some walking, or get off the car, walk some distance, things like that we can incorporate into our daily activities. That will be good enough. Irregular heartbeat, I don't think we can do something about that, but it's good to know.
No, we can. Irregular heartbeat. These irregular heartbeats, there are treatments and procedures that we can do to try and convert an irregular heartbeat into a normal heartbeat.
Fantastic.
There are medication that can be given that can help as well. So and then it's all about trying to figure out the cause of the irregular heartbeat, because sometimes it could be dehydration, it could be an infection.
Okay.
So it's not that we can't do anything about it. It's something we definitely can.
Okay.
It's something we need to know about, because if it's something that's persistent, then you need medication to reduce your risk. So the fact that heartbeat is irregular is an issue, but we can do something about trying to reduce the potential consequences of them.
Okay, that's fantastic. So anybody that is facing that issue is another thing to go and check and find a way out of that. And sickle cell as well. So we know that that is inborn, but there's some measures that we can take to
so there's certain things that one can do as well with that. It's a big topic, but it's about trying to reduce your risk of crisis, keeping hydrated, taking the medication that's advised as well to try and reduce your risk of infection and things like that. I do very quickly, because I'm just conscious of time, want us to talk about the potential treatment and why it's why the time was there in the FAST. And the importance is that the vast majority of strokes are the type that's caused by a blockage in the pipe, which is the blood vessel supplying the brain. For these types of stroke, the quicker you get to a hospital to seek urgent medical attention, there is a potential medication that can be given to try and break down this blood clot immediately, to try as soon as possible to try and recover the blood flow to the brain. Okay, so this is why T is important. So this drug, there's a certain time that we know that it's potentially effective, and this time is usually between 3 and 4.5 hours. So if you sit at home waiting 4 hours, 5 hours before you get to the hospital, it's too late. You might have missed the boat. And the potential medication that can reduce, because what you're trying to do is to prevent the brain cells from dying. So if they're dead, they're dead. Okay,
it can't be resurrected.
So they don't just all of a sudden. But if they're in the process of dying, then by recovering the blood flow to the brain, then you can potentially save brain cells. That might mean that you can have a better recovery. So it's very important that you get to seek medical attention as soon as possible. That's why T is very important. And some people say, just like time is muscle for heart attack, some people say time is brain as well, or brain cells. So this is very important.
So is that the only treatment for stroke?
Well, treatment for stroke, first of all, we want to obviously prevent further strokes. So some people have a stroke that doesn't cause significant problems or disability, which we've talked about earlier on. So part of the treatment will be to try and reduce the risk of further strokes. To try and the other things is that we have to, part of the treatment is treating the effects of the stroke as well. So if you're someone that has end up having problems with your speech, there's speech and language therapy. If there's someone that has had problems with weakness, then there's physiotherapy. Some people are going to be left with lifelong disability, and they're going to need extra help at home in terms of with equipment that can make things easier. So you've got occupational therapists who are in this country anyway, who are skilled with this, but also some people end up unfortunately needing an extra help at home with their day-to-day activities like dressing up and things like that. So social services might be able to provide carers as well. So there are medications we can give to reduce your risk of further strokes. We give medications to thin the blood as well. But then it's also treating the effects that the stroke has given you as well. So these are the things that one thinks about.
What's the survival rate for the when the pipe burst in the brain?
So 8 out of 10 stroke patients in UK survive their hospital stay. So a lot of people survive the stay, but 2/3 are able to return home to live independently or with support. So some people end up having to go to a care home or a nursing home afterwards. So a lot of people are now surviving stroke, but surviving is one issue. It's the disability that what you might have afterwards. That is another issue.
The quality of life.
The quality of life. It can be a big change to one's life, yes.
Fantastic. Thank you so much, Dr. Kenny. This is very, very, we are well informed now about stroke. And the bottom line is that we don't want to find ourselves in this particular situation. So whatever that needs to be done so that we won't suffer stroke, so that we won't be clamped down with diabetes, so that high blood pressure will not be bring complications in our bodies, we need to do them. And that is the key thing, that we should go and check our health. When you go to your doctor, check your high blood pressure, check your blood sugar. You don't need a doctor to check maybe you are smoking or not. You need to make a decision to stop smoking and get help if you need to. And diet as well. We don't need someone to tell us that we are eating poorly, because we know, we have talked about food for purpose on this program as well. What is good for our body? And I know many of us know, we just want to ignore. We need to begin to, if you don't know, there are so many resources that you can check what is good for your body. Obesity, we know that we need to get off some weights from our bodies, and that will help us a lot. So lack of physical activities as well. We've talked about how we can get our physical activities imbibed in the day, and we shouldn't forget about this. Sitting for too long as well is very, very bad for our health. If you haven't followed us from the beginning, you can go on the SoundCloud and download all these messages. The heart attack one is there, this stroke is there, the diabetes is there, the anxiety, everything is there. Just type Jummy Opedare. Let's believe you will get the message. God bless you. I just pray whoever that is in this situation right now, that God will give you comfort, God will heal you in the name of Jesus, and God will give us wisdom to manage our health, so that we will not abuse the body that God has given us. I pray that God will continue to be with us. We will not be clamped down with sickness at any point in our lives, in the mighty name of Jesus. Thank you for tuning in again today. God bless you and stay safe.
Meet Pastor Jummy Opedare, a devout woman of God, wife, mother, and entrepreneur. A God-fearing woman who has devoted her time to ensuring that God's message is used to empower everyone, but most especially women. With a strong belief in the importance of women empowering women and educating each other through our life experiences, she is the founder of Women's Forum, Let's Be Real, a forum for women to work through issues and set and accomplish goals together. Held every second Friday of every month at 6 Elton Road, Lee Green, London. Keep up with Let's Be Real here on PRZ FM every Tuesday, 8 p.m. to 9 p.m.